I'll call today's meeting of the Minnesota Senate Commerce and Consumer Protection Committee to order. Today is Tuesday, March 10th, 2026. A quorum is present. The first item on our agenda is Senate File 3859, brought to us by Chair Klein, and I believe there is an A7 author's amendment. Can you explain your amendment, please, Senator Klein?
Madam Chair, I offer the A7 as an author's amendment.
All right. A7 is an author's amendment. All those in favor of adopting it, say aye. Aye. Any opposed, say no. The motion carries and the author's amendment is adopted. To your bill, Senator Klein.
Thank you, Madam Chair and committee. Madam Chair, the American Advisory Commission on Immunization Practices has been a trusted source of health information for Americans for many administrations and many years. It has been a nonpartisan and respected font of knowledge for physicians and families and parents and seniors in our country. In the last year, we've seen that institution gutted and replaced by people who have marginalized theories on immunization practices that are not supported by the medical community as a whole. Senate File 3859 as amended is in response to that change. Minnesotans need and deserve reliable science-based information about their health and about which vaccines are safe for them and their children. The Senate File as amended would create our own advisory council here with our best medical experts here in the state of Minnesota so that Minnesotans can make informed decisions about vaccination practices. Notably, this bill is not a requirement or a mandate that anybody take any vaccine at all. It simply is going to offer Minnesotans the very best knowledge so that they can make their own decisions. And the bill also requires these vaccinations to be covered by insurance and public programs as they always historically have been. This is particularly relevant not just as a theoretical matter, Madam Chair. In the state of South Carolina now, they are dealing with a raging measles epidemic. Measles, a disease which by all rights should have been eradicated a generation ago, but exists only because of misinformation about vaccines in our time. So I am urging the committee to support the bill, and I have testifiers.
Thank you, Senator Klein. Would Lisa Matson and Caitlin McLean please step to the testifiers table? All right.
Thank you, Chair and committee members. My name is Dr. Lisa Matson. I have the honor to serve as president of the Minnesota Medical Association. Minnesota is currently experiencing concerning declines in vaccination rates, while outbreaks of vaccine-preventable diseases are increasing nationwide. Minnesota is currently the 4th worst in the nation when it comes to childhood vaccination rates. This leads to increased cases of preventable illness, avoidable hospitalizations, and heightened risks to those who are immunocompromised, like those with cancer and certain autoimmune diseases. On behalf of over 10,000 physicians in Minnesota, the doctors, the medical experts in this area, vaccines are safe. They are one of the safest, most effective, and most cost-efficient tools we have in modern medicine. Let's put safety in perspective. We mandate car seats for children, but car seats decrease the chance of death by infants by only 71% and by only 54% in toddlers. Yet vaccines are greater than 90% effective. We can never offer 100% safety. We do know that when vaccination rates fall, schools, workplaces, and healthcare systems all become less safe and vulnerable to outbreaks of preventable disease. Back in 2021, I worked for a large company that studied cases of COVID that required hospitalizations during that year. 10% of those hospitalized had been vaccinated, and their average cost of care was $150,000. Of the 90% who were not vaccinated, their average cost of care was $550,000. Vaccines are cost-effective. Uncertainty over which vaccines are recommended and whether they come with an out-of-pocket cost have led to patients delaying or declining recommended vaccines. This bill removes both the financial barrier and the confusion about which shots people should get. If it becomes law, this legislation will improve individual health outcomes, strengthen community protection, and reduce long-term healthcare costs associated with preventable disease. I respectfully urge you to support Senate File 3859. Thank you for allowing me to testify. I'm happy to answer any questions you may have.
Thank you, Dr. Mattson. Our next testifier, is it Dr. McLean?
Correct.
All right, Dr. McLean, please identify yourself and proceed with your testimony.
Thank you, Chair and members of the committee. My name is Dr. Caitlin McLean. I'm a physician who has the privilege of caring for children, and I came here today directly from a pediatric emergency department. I am here today representing the Minnesota chapter of the American Academy for Pediatrics, the leading voice for children's health in our state. We proudly represent more than 1,000 pediatricians across Minnesota. Thank you for the opportunity to testify today in support of Senate File 3859. Routine childhood immunizations are one of the greatest public health achievements of the last century. Because of vaccines, disease that once caused widespread disability and death had become rare. Unfortunately, even in my short career, I have seen severe childhood illness and disability caused by diseases that could have been prevented by immunization. A few brief examples. I have personally seen a child that will never hear again because of the flu. I have seen a child on a ventilator because of the measles. I have seen a child with numerous brain bleeds because of vaccine-preventable meningitis. The list could continue, but I know that we have a time limit here today. These and countless other cases that we don't have time to share today are becoming more common as the vaccination rates decline here in Minnesota. Recent reporting shows that Minnesota is among the lowest in the nation for kindergarten vaccination rates against measles, as just shared by Dr. Mattson, well below the 95% threshold needed for community immunity. As we are seeing nationally, mentioned by Dr. Klein, measles spreads quickly and can have numerous impacts beyond childhood health, including on the economy, the workforce, and straining our already taxed healthcare system. But this trend extends beyond measles. We are also seeing lower rates for other routine childhood vaccinations, like increasing the vulnerability to outbreaks of whooping cough, influenza, and other preventable illnesses. Even modest declines in vaccination rates increase pockets of risk, particularly for infants who are too young to be vaccinated and children with chronic conditions who rely on community protection. For pediatricians, prevention is foundational. Vaccines not only prevent acute illness, but they also prevent hospitalizations, long-term complications, missed school days, and strain on families. Strengthening access to routine immunizations is an investment in children's long-term health and the stability of our communities. Thank you for your time. On behalf of the Minnesota chapter of the American Academy of Pediatrics, I respectfully urge your support for Senate File 3859.
Thank you, Dr. McLean. Any questions or comments from members of the committee? Senator Green.
Thank you, Madam Chair. When you first read the bill, it looks like the language appears to insinuate that the vaccines are not now covered by insurance, and I think you've stated that they are. So, I'm not sure why that's in there. The other is just a question for me, because I've been getting some concerns about the bill, and I don't know, so I will ask your testifiers. Do you have the information that you talked about as far as your statistics on vaccines? And one of the questions that was brought to me was the vaccines, and a lot of people now are saying that they believe that the increase in autism is from vaccines. Do you have any information on that?
Dr. Mattson.
Thank you. Actually, I'm very glad you asked that question, Madam Chair. Thank you. I'm glad you asked that question. I was recently reading in my Journal of American Medical Association, and just recently the WHO, the World Health Organization, reported on a review of autism and vaccinations, thimerosal and aluminum, reviewing papers from 2010 through 2025. This is their fourth review of this subject, and for the fourth time, they have found that there is no causal relationship between these items, the vaccines, thimerosal or aluminum, and autism. I understand autism is a horrible diagnosis to have for your child, and people want to have something to blame, but we simply do not have the evidence to suggest that there is a causal relationship there. And the WHO is a huge organization that advises the entire world on their vaccination recommendations.
And I'd like to personally jump in here with, as a mother of a child with autism, I'll quibble a little. It's not a horrible diagnosis. It's a wonderful character trait that my child has. It's just a way that they think differently, perceive the world differently than I do. And I would rather have a happy, healthy, wonderful child with autism than somebody who is crushingly disabled or died because of a preventable childhood disease. Senator Green.
Thank you, Madam Chair. Thank you for that answer. And if you can maybe shoot me the link to that so I could read it so I have answers myself. The other question that was brought to me was from a person whose child, after they got the immunizations, I think they're the 7th grade shots or whatever, and they give you all, it used to be 7, but I think it's much more than that, contracted Guillain-Barré syndrome. Do you have any information on whether or not there's a link between certain vaccines and Guillain-Barré syndrome?
Who would like to? Senator Klein.
Madam Chair and Senator Green, Guillain-Barré syndrome is a known complication of any immune process, whether it be a viral illness or an immunization, and has been documented as such by the medical community. Once again, the bill in front of you does not mandate that any particular individual, including your correspondent, take a vaccine. It's simply providing Minnesotans with the best medical advice based on scientific research that they can have access to.
Senator Green.
Madam Chair, just one comment, and then that's, reading through the bill, and you're putting in another commission, basically, or council, and mostly made up of people that I think are already suspect when it comes to the government and the government involvement. And so I'm not sure that what they're going to put out is going to give people a lot of ease, but it would be certainly good to see the information, and I'll look forward to seeing that if the bill should pass.
All right. Senator Dames.
Well, thank you, Madam Chair. And Senator Klein, could you tell me, as I understand, you've applied for fiscal note and you have not received it, is that correct?
Senator Klein.
Madam Chair, Senator Dames, that's correct.
And will
Senator
this bill,
Dames.
Thank you, Madam Chair. Will this bill be forwarded to another committee?
Senator Klein.
Madam Chair, Senator Dames, yes, this will go to state government, HHS.
Thank
Senator
you, Senator
Dames.
Klein. Thank you, Madam Chair. I do get concerned passing bills out when we don't know what the cost is going to be, and we're the primary committee for this bill, so I do have that concern, but thank you.
Senator Wickland.
Thank you, Madam Chair. First, I support Senator Klein. You're bringing this bill forward. I appreciate you bringing it forward. I think it is important for Minnesotans to have a way to know that they are able to access reliable and correct recommendations for vaccinations. And I appreciate your work on developing a way for Minnesota to stay up to date with that. I do have questions about related to the amendment, and I wanted to find out a couple things about the language you added to require that the state pay, compensate or reimburse the health plan companies for the coverage. One question is that it seems to apply to two of the clauses, the two clauses that were added about American Academy of Pediatrics and then your Minnesota Science-Based Vaccine Advisory Council, but not Clause 1. And I just wondered if there was a reason for that. Why would we have a state, like a reimbursement cost for those two clauses only for vaccinations?
Senator Klein.
Madam Chair, Senator Wickland, my intention in crafting the bill, and I believe council can advise me whether I've been successful in this, was simply number one, to ensure that there's no retreat from the coverage that all of our programs currently have for insurance and public programs around current vaccination recommendations. And so it's my understanding that, you know, once this advisory council gives their recommendations on vaccination schedules, health insurance will continue to cover them as they already are, and we'll just make sure that there's no possibility of retreat on that. We will create a mandate that they cover them as they currently are. And then you know that it's been my principle as Commerce Chair that if we do put a mandate in state law that health insurance covers a certain procedure, that we should not allow that cost to fall upon individual ratepayers, but that the state should defray it should there be an increasing cost. And I would say two things. First of all, I don't anticipate there will be an increasing cost, but I want to be philosophically consistent with what I've counseled other authors who bring mandates before this committee to do.
Senator Wickland.
Okay, maybe I'll talk to you some more about it. I guess I don't see a reason that one of the advisory paths is not included in that, but, and then, so your intention in this case is to go beyond what the ACA requirements are and to have defrayal of costs for all of the markets that we have state regulation over?
Senator Klein.
Madam Chair, Senator Wickland, I think that would only pertain should there be an expansion in current, vaccination schedules. So it would be defrayed should there be additional costs to individual ratepayers over what they're already doing. So,
Senator Wickland.
Well, I guess I just say I have a concern about that. If we feel that vaccinations or the vaccines are under the statement that immunizations for routine use in children, adolescents, and adults should be covered with no cost sharing, it just seems like that's something that we want to continue. So I have some concerns about adding the defrayal language in this way. So thank you.
Senator Duckworth.
Thank you, Madam Chair. I appreciate it. Just a couple of questions for the bill author. Specifically regarding the advisory council. In the absence of this council currently existing, what is the state of Minnesota relying upon in terms of these recommendations or the information?
Senator Klein.
Madam Chair, Senator Duckworth, I guess the answer would be the state of Minnesota, currently doesn't have a body that gives these recommendations. We've relied for our medical recommendations on the ACIP, the federal organization that gives standard vaccinations recommendations, but they've lost their credibility, so we're going to have to do it on our own.
Senator Duckworth.
Thank you, Madam Chair, and thank you, Senator Klein. And so in the absence of some folks maybe having a difference of opinion as it relates to the federal agency or department that currently oversees this, that's why you're proposing that Minnesota create its own? Is it, I see you nodding. Are there other states that have their own, or has this been something that's pretty common practice, or is it more of an emerging trend, would you say?
Senator Klein.
Madam Chair, Senator Duckworth, that's correct, yeah. So, and in response to sort of the changes that have happened at the federal level with ACIP, you have probably heard there is a West Coast Alliance, a conglomeration of states that are doing largely what's in this bill, trying to use their best medical resources within their states to give their citizens the best possible advice. We, of course, have outstanding medical research institutions in the state of Minnesota and should have ample capacity to sort of give best advice to Minnesotans.
Senator Duckworth.
Thank you, Madam Chair. And I'm not going to wade into what could obviously be a much more politically interesting conversation as it relates to that. But I will say, from a state legislative standpoint, not a federal one, I do wonder what precedent we begin to set, or what situation we may find ourselves in if we have the federal government coming out with recommendations which most states have historically relied upon, and then we've got states coming out with their own versions. It would seem to me that our country or our residents or citizens are well served by sort of a uniform approach to this. I'm sure I'm sort of making a portion of your argument, so I'm not going to go down that road. But I just want us all to be mindful of what that means, or what we could end up with if we've got 50 different recommendations from 50 different states versus a more unified approach to this. All that to say, also, if we can avoid duplicating efforts, I think that's a good thing as well between federal government and state government. My last question has to do with what's contained on page 6, and I apologize if this was addressed in the author's amendment. I didn't have a chance to read it in full. But essentially, when I look at lines 6.3 to 6.5, a portion of it says that the chair of this advisory council may call for an override vote if they essentially disagree with or have a difference of opinion with what the commissioner has decided, and that if 2/3 of the advisory council vote to override the existing state vaccine schedules, the advisory council may republish the advisory council's own recommendations to serve as the state vaccine schedules. I'd be very curious, number one, to hear what the commissioner thinks about that. And I'm also curious to know if in any of our departments or agencies, if something like this exists where a commissioner could essentially be overridden by somebody other than the executive themselves or by the legislature.
Senator Klein.
Madam Chair, Senator Duckworth, I don't know if other agencies have language like this. I will say I'm very fond of this language. I think it follows the pattern of checks and balances that we use at multiple levels of our democracy, both state and federal, and allows a single commissioner who may have eccentric views or may not be fully in their full capacity to have the balance of an override by 2/3 of the council.
Senator Duckworth.
Thank you, Madam Chair, and thank you. I would, of course, assume that would probably be your opinion on the matter. I think it would be interesting for us, though, to look across Minnesota state government and see if this really does exist anywhere else. Give some thought to the second and third order effects of what something like this might actually mean, how it might play out, and what sort of precedent it sets. And then maybe there's some other powers we want to give ourselves in the state Senate to override different folks on things. Just food for thought. I understand why you brought the bill forward, and overall, I'll just say I'm hopeful that we can move everybody in a direction that gets back to more uniformity, more agreement, and puts folks and their well-being at the forefront of the decisions that we're making. That's all I've got, Madam Chair. Thank you.
Senator Latz.
Thank you, Madam Chair. Two things quickly. One is I recognize the point that Senator Duckworth just made, but I will note the Senate and the House together do have the ability to override decisions made by the executive branch. If a governor vetoes something that the legislature in its wisdom thinks ought to become law, and 2/3 of the legislature agrees, we can override an eccentric position of the governor as well. So I don't see this as a challenging precedent. But I did want to push back a bit on Senator Green's suggestion that the membership on this committee was somehow suspect that's being proposed. I read through the bill here from line 4.3 to line 5.9, and I can't find any proposed advisory council member that is suspect in any way with regard to credibility or scientific expertise or background or being able to bring a great amount of value to an advisory commission of this nature. A physician appointed by the Minnesota Medical Association. I'm a physician appointed by the American College of Physicians, American Academy of Pediatrics, Minnesota Academy of Family Physicians, American College of Obstetricians and Gynecologists, a registered or advanced practice nurse appointed by the Nurse Association, a pediatric nurse, licensed school nurses, healthcare providers, pharmacists. These are exactly the people I want reviewing the literature and making decisions on what vaccines we need to protect our population. I don't see anyone in here that I'd be concerned about, and I'd be shocked if any of these associations that would have responsibility for making the appointment would put forth someone who didn't have any knowledge, credibility, expertise, scientific training, far more than I will ever have, to advise us. And I'll tell you, this is really, really important. There's 4 days ago, North Dakota had a measles outbreak. One person was identified. 3 days ago, they identified a total of 23 in North Dakota. Members, this is not an esoteric intellectual argument about what we may or may want to do. We might have a measles outbreak in Moorhead tomorrow. It might be happening today. It might be down here in the Twin Cities the same day. Moorhead's only a 4 or 5 hour drive from here, right? And then your kids could die because North Dakota didn't get all the vaccinations they should have gotten, and someone got a measles outbreak there. So this is really, really serious. And for anyone in this committee to start putting forth information that calls into doubt the legitimacy of the science behind these vaccination recommendations is really risking Minnesotans here. And I would really encourage people, before we start spreading false information and false hysteria about vaccinations, let's open our eyes and our ears and our minds to the reality of the science that's going on here, because we are all at risk if even a small portion of us decide we're going to avoid vaccines because we're scared of something that we heard about, and especially coming from opinion leaders and elected officials, that's particularly dangerous. Thank you, Madam Chair.
Any other questions or comments from members of the committee? Senator Klein, thank you for bringing this bill forward. As you know, I work on an ambulance, and I am at the front lines, and I see people before they get to you, all at the hospital. And we have been receiving increasing guidance from our medical direction as to what measles looks like, what to look out for when it comes to measles, because there is a real concern, and it is something that we do need to be aware of. And it's so entirely preventable that it sort of boggles my mind why anyone would not want to spare their child from this horrible disease. Senator Klein, any final thoughts?
No, Madam Chair. You and Senator Latz really have said it all. And I guess to speak to the point about I wish we had federal consistency, which Senator Duckworth raised, so do I. And if we had reliable institutions as we have had for generations, we would have federal consistency. This is an emergency measure in response to a failure of that federal advice.
Klein. The question is on the motion of Senator Klein that Senate File 3859 as amended be recommended to pass and be re-referred to the Committee on Health and Human Services. All those in favor say aye. Aye. Any opposed say no. No. Motion passes and the bill is on its way. Thank you, Senator Klein.
Senator Seeberger, Senate File 3779 is in front of the committee.
Thank you, Mr. Chair. I am pleased to be here before the committee with my Senate File 3779, which deals with travel insurance. Travel insurance is a discretionary product that provides peace of mind by providing coverage for the financial losses that can occur while traveling, such as lost or delayed bags, a last-minute trip cancellation, or a medical emergency overseas. Last year, over 1 million Minnesotans chose to purchase travel insurance, including me. Travel insurance also provides non-insurance services like access to 24/7 global assistance services that can help travelers with everything from replacing a lost passport to arranging medical treatment in an emergency and providing translation services at a foreign clinic. I wanted to provide a quick real-world example of how travel insurance works. A consumer was traveling in Italy when they suffered a stroke. They needed an air ambulance to a hospital as well as treatment and airfare home, expenses that were not covered by their health insurer. In the end, the medical expenses covered by their travel insurer were over $70,000, and the consumer was also reimbursed for trip interruption. The premium for this plan was $70. Travel insurance is a unique insurance product not only because it contains insurance and non-insurance components, but also because of how it is sold. Every travel insurance transaction ultimately involves a licensed insurer and producer. but it is often a travel agent, airline, or cruise line that is offering the travel insurance product to customers. Senate File 3779, which is based on the National Association of Insurance Commissioners model, provides a regulatory framework that addresses the unique aspects of travel insurance. Specifically, the bill provides important consumer protections and clarifies the responsibilities to the consumer of every entity involved in the sale. My testifier, Duke DeHaas, will provide more detail in a moment. However, I'd like to emphasize that to date, 41 other states have enacted a version of the Model Act, and 7 more are considering it this year. The Department of Commerce is neutral on the bill, and I know of no opposition.
Thank you, Senator Seeberger. Mr. DeHaas, please introduce yourself and proceed.
Thank you, Chair Klein. Good afternoon, Chair Klein, members of the Senate Commerce and Consumer Protection Committee. My name is Duke DeHaas. I'm Vice President and Deputy General Counsel of AGA Service Company, which I'll refer to as Allianz, and I'm also co-chair of the United States Travel Association Law and Regulation Committee. The USTIA's members include insurance carriers, third-party administrators, insurance agencies, and related businesses in the development, administration, and sale of travel insurance and travel assistance products. Allianz is a writer of travel insurance, and it has an insurance company as well as a fully licensed travel insurance producer authorized to do business in all 50 states, including Minnesota. Thank you for bringing Senate File number 3779 for the committee today. Thank you to Senator Seeberger and Senator Dames both for authoring this legislation, which is important both for travel insurance consumers and the industry. Travel insurance is a unique product within the insurance industry because it contains both insurance and non-insurance elements, and because it is often offered by a travel agent, airline, cruise line, et cetera, not by a licensed insurance agent, which is why it is critical that each entity involved in providing travel insurance clearly understands their responsibilities to the consumer and that consumers understand how to use the product. SF number 3779 provides this clarity for all involved in the transaction. The legislation also builds upon the existing licensing and regulatory structure in Minnesota by adding new consumer protections, which include a free look period for refunds, important disclosures such as how to file a claim and who the consumer should contact if they need assistance, and a prohibition of illusory insurance, which is a policy that due to exclusions and other provisions does not provide meaningful coverage. The legislation will also expand consumer choice and availability of travel insurance products in Minnesota by defining and providing for eligible groups through which travel insurance products can be sold on a group or blanket basis. This would permit, for example, a group of students attending the University of Minnesota or church members going on a group missions trip to be covered by the same travel insurance policy purchased by the university or church. Finally, the bill standardizes definitions and provides a clear roadmap for how the travel insurance product is to be filed with the department, which should assist in providing new and improved travel insurance products for consumers while also including the strong consumer protections in the bill. Thank you for your time and consideration with all that you have on your plate. I'm happy to answer any questions.
Thank you, sir. Are there any questions or comments on the bill? Senator Rest.
Thank you, Mr. Chairman. I wonder if the author or her testifier or Senate counsel would go through the sections of the bill. We've heard why it's a good thing, but I'm really interested in the new language that's here.
Senator Seeberger or counsel, do you have a
Anybody?
preference?
I can allow counsel to do that. Thank you, Chair Klein.
Counsel.
Thank you, Mr. Chair, members. I'll do just an overview of the different sections within the bill and be available for any specific questions. Section 1 amends existing statute, Section 60K.383, which is travel insurance. It adds definitions related to travel insurance, limited lines, travel insurance producer, offer and disseminate, and amends existing definitions of travel insurance and travel retailer. Subdivision 2 authorizes the commissioner to issue limited lines travel insurance producer licenses to an individual or entity that has filed an application with the commissioner. Going down, subdivision 3 is just some technical and clarifying changes. And then subdivision 4 requires limited lines travel insurance producers to use reasonable means to ensure compliance by the travel retailer with this current section that we're in right now, section 60K.383, and then chapter 65C, which is a new chapter that's being included in this bill. Subdivision 5 authorizes a person's license in a major line of authority as an insurance producer to sell travel insurance as well. So then that's section 1. Sections 2 to 8 establish a new chapter of law, chapter 65C. So section 2 establishes the scope of the chapter. Section 3 defines several different terms related to travel insurance. Section 4 establishes that, or Section 4 requires travel insurers to pay the premium tax provided under Section 297I.05. Section 5 relates to travel protection plans and establishes regulations related to travel protection plans. Section 6 provides consumer protection requirements related to illusory travel insurance, marketing, provisions on opt-outs, and other protections. Section 7 addresses and regulates travel administrators. Section 8 establishes requirements related to rates and filing. And those are all the sections. Thank you.
Senator Rest.
Thank you, Mr. Chairman. Mr. Chairman, Senator Seeberger, this is a lot of new language. It's not a page and line kind of introduction of new law. So I hope you're not offended that I'm interested in more detailed explanation of the bill. And this is it's a model bill, I understand, Mr. Chairman. So how many other states, and maybe you already said this, and I missed it, how many other states have adopted this exact same language?
Senator Seeberger.
There are 41 other states that have adopted a version of the Model Act.
Mr.
Senator
Chairman,
Rest.
and are other states considering it now, or are they just not interested?
Senator Seeberger.
7 more states are considering it.
Okay. Thank you, Mr. Chairman. Senator Seeberger, that's very helpful.
Senator Dames.
Thank you, Mr. Chair, and thank you, Senator Seeberger, for bringing this bill forward. We truly do appreciate it. One thing, this bill will make the market more competitive, certainly bring in a lot of new products, and it'll make it easier for travelers to pick out, design a traveler's policy that best fits their needs. So thank you for bringing this forward.
Senator Duckworth.
Thank you, Mr. Chair. Just a couple of quick ones. Just curious for the bill author, have you got the Department of Commerce Commissioner's take on this, just out of curiosity?
Senator Seeberger.
Thank you, Mr. Chair. Yes, Senator Duckworth, the Department of Commerce is neutral.
Senator Duckworth.
One follow-up. Is there an insurance advisory council that could override her decision regarding insurance with a 2/3 veto vote? I'm obviously being facetious with my question. But I raise it just because when I look at the laws that we pass and the bills that we pass and how we structure them, I think consistency is important. I'm in favor of the bill, but I'm just highlighting some of the implications that how we approach certain things might have specific to this department or other state departments and agencies as well. That's all I've got, Mr. Chair. Thank you.
Thank you, Senator Duckworth. Any other questions or comments from the committee? Senator Seeberger, anything closing?
Thank you, Mr. Chair. I'm happy to bring this bill forward. For those folks out there who are not an insurance nerd like me and don't read through prospective policies, this provides some form of protection in that now entities that offer travel insurance have to describe what's in the coverage. It has to describe how to process a claim, has to describe how to cancel the policy. It prevents the illusory travel insurance, which is insurance you buy, but it doesn't cover anything. And I've run into that before. Years ago, when I was looking at buying travel insurance, I read through the policy, and the amount of exclusions excluded any potential claim I would have ever had. But not everybody's an insurance nerd like me and wouldn't catch that in a policy. So I'm grateful that now we are establishing some parameters so that this particular product can be more widely available and better serve the consumers of Minnesota.
So the question is on the motion of Senator Seeberger that Senate File 3779 be passed and referred to the Committee on Taxes. All those in favor say aye. Aye. Opposed? Motion is adopted. The bill is on the way to taxes. Next up, Senate File 4256, Senator Hoffman.
Mr. Chairman? Mr. Chairman,
Senator Rest.
could I just ask, what in the bill resulted in a request for the bill to go to taxes?
Senator Rest, if you'll look at page 9, section 4, the premium tax.
Okay.
Senator Hoffman, welcome to the committee. Please go ahead.
Mr. Chair, thank you. I was going to try to start off with a joke, but I realize it's probably not appropriate to do so. Because this isn't judiciary where you guys have so much fun, right, Ann? I'm here today presenting Senate File 4256. Well, I don't think we need to do this in legislation. However, it is necessary because some recent local government actions with support of a state agency are telling long-term care facilities that they need a liquor license to hold a happy hour type events for residents. I agree, Senator. I have 3 testifiers today and a number of residents from my district in the gallery. But in brief, there is an amendment that would provide a limited exemption to our liquor law for licensed assisted living and nursing home facilities when the consumption of alcohol is for resident activities, basically happy hour for grandpa and grandma. While I appreciate that our liquor laws and regulations are designed to provide oversight, protect health and safety, and establish clear rules for buying, serving, and consuming alcohol, we must also recognize when sometimes government goes a little bit too far. These are licensed healthcare facilities that are already subject to the Minnesota Department of Health rules governing food safety, storage, and service, as long as we'll have other services providing within that MDH world. Also, within the Department of Human Services, there's lots of regulations that need to be established as well, requiring a duplicative regulatory framework yet for another agency and increasing costs for everyone who lives there. It just doesn't make sense, Mr. Chair. I understand the Department of Public Safety had concerns, and we appreciate their willingness of the agency and the long-term care associations to continue the discussion on that. I just wanted to let you know that I assure that we and the advocates in supporting of all this change will find a way to be safely doing it reasonably, Mr. Chair. So Abigail Dahl, Anita LeBrun, and Kyle Burnt are here for testimony. So thank you.
Senator. Senator Latz.
Before we go into testimony, could the record reflect that the chairman of the Judiciary Committee would like to see Senator Hoffman and this bill in front of Judiciary when we're done here? I'm just kidding. I'm withdrawing.
Ms. Abigail Dahl, thank you so much for coming to the committee. Please introduce yourself and proceed.
Okay. Hi, Mr. Chair, members of the committee. My name is Abigail Dahl, and I'm the Executive Director at Amira Choice Champlin. I am here to testify in support of the amendment exempting licensed assisted living facilities and nursing homes from needing a city liquor license to serve resident happy hours. About a year ago, my organization was celebrating the completion of a major renovation project. As part of that celebration, we wanted to plan a reception and a champagne toast. So I reached out to my local city for guidance and to notify them of the plans. Imagine my surprise when, as the conversation evolved, I learned that licensed facilities like assisted livings and nursing homes were technically not allowed to coordinate resident happy hours without a liquor permit. As Anita will share shortly, this is their home. They are legal adults. We were shocked to learn that we would need a permit, one that would add cost and license and permit fees, liquor insurance, and extra red tape. The kicker is, for my city and for many other cities in Minnesota, not every city has a local permit that fits our situation. No sale, just resident-focused activities. Assisted living facilities are already accountable to over 500 regulations governing the health, safety, and well-being of residents in our care. That includes being licensed as a food establishment through the Health Regulation Division of the Department of Health, regular, thorough kitchen inspections by the Environmental Health Division of the Department of Health. We must have a certified food protection manager on staff, and when they're not on site, there must be a person in charge. Following strict sanitation, temperature control, and safety protocols. We already train staff on proper food safety, including proper food storage, proper labeling and handling, and protection from contamination, proper cleaning and sanitation, according to code standards of food contact surfaces, utensils, and equipment, maintaining employee personal hygiene, appropriate hand washing, glove use, illness reporting, etc. Lastly, licensed nursing homes and assisted living facilities already have existing safeguards to assess cognitive status, monitor medication interactions, document resident choices, supervise residents with impaired judgment, and implement care plans for those with substance abuse concerns. In other words, assisted living and nursing home dining operations are already operating under a comprehensive public health regulatory framework designed to prevent foodborne illness and protect residents. Requiring a liquor license is simply red tape without value. It is duplicative, not protective. Thank you for the opportunity to testify and share our experience today.
Thank you for your testimony. Ms. Anita LeBrun, please introduce yourself and go ahead.
Good afternoon, Mr. Chair, members of the committee. My name is Anita. I am a resident at Amira Choice in Champlin, Minnesota. I am here not just on behalf of myself, but on behalf of the entire community of residents of the assisted living community who are trying to live our lives. Just because we are older and live in an assisted living doesn't mean that we should have fewer freedoms than anyone else. Imagine our surprise when the community we have chosen has to stop coordinating social events that bring us together. My friends and I love happy hour, just like many of you do, I am sure. Over a shared drink, we get to reminisce about parts of our life, military service, raising a family, the loss of a friend, and celebrating the golden phase of our lives too. Allowing our facility to coordinate this happy hour affords us and our families the peace of mind that we can enjoy life, but not be out slipping on the ice to stop and get our box of wine. The staff of our facility have our care and well-being top of mind. They are highly trained and ensuring our safety already. This amendment is simply putting into law what many people assume is already allowed. Happy hour at the place where we call home. Thank you for your time to testify today.
Thank you, Ms. LeBrun. Is Kyle Burnt present? Welcome to the committee. Mr. Burnt, go ahead and introduce yourself and proceed.
Hello, Mr. Chair, members of the committee. My name is Kyle Burnt. I am testifying here today on behalf of the long-term care imperative in support of Senate File 4256. You've heard the previous testifiers and the author speak to the bill, and I won't go too deep into those because they've covered pretty much everything. But I wanted to appreciate the supportive letter that we received from our consumer advocacy friends. Of course, what you did hear from them is that, or from our previous testifiers, is that assisted livings are licensed and they have to follow Minnesota Food Code. Nursing facilities have federal food standards that they have to follow. Both facilities are highly regulated senior caregiving health-focused facilities. And would like to also remind legislators that a similar exemption to what we seek is already in statute in 340A.4011. While not the same, it is kind of where we pulled our idea from. But we did hear from DPS. There is a letter in the packets that addresses some of their concerns, and we will continue to work with them to address those concerns as we move forward. We ask for your support of the Senate File 4256. Thank you.
Questions or comments from the committee? Senator Duckworth.
Thank you, Mr. Chair. I guess it's to be expected that Senator Hoffman would bring forward the happy hour Bill of Rights. Well played. My only regret is that we might not get invited to one of these happy hours if it gets passed.
He wants to come.
There's an age threshold there.
I see how it is. I see how it is. That being said, I just wanted to get it on record, Mr. Chair, that the way that I read this bill, should it ever become a point of contention in the future, is this would allow the great city of Lakeville to expand and have a social district in their downtown area. Should any assisted living facilities or nursing homes be co-located. So I support this bill all around, and maybe we should expand upon it some more.
Other questions and comments from the committee? Senator Duckworth, I'll let you have the final word. Senator Hoffman, I'll let you have the final word. But just want to say thank you to your testifiers. Thank you for bringing a little common sense to the Commerce Committee. This bill is going to go to your committee.
Yeah.
And your statement was exactly correct, that this is a little bit of government overreach, and I'm glad to have had a hand in sort of bringing it back so that people can live their lives and have a happy hour. So your final words.
Mr. Chair and members, thank you. And then also, Senator Rasmussen, you'll get a kick out of this. If you look at the letter from the Consumer Advocates Coalition, right, the long-term care imperative, along with our Office of Ombudsman Long-Term Care, the Office of Ombudsman for Mental Health, AARP, and the Elder Justice Center, all in our agreement. I don't ever think that's ever happened. Well, it has, but this is one of these, so it's coming. Thank you very much, Mr. Chair and members, for your time and attention to this. I look forward to it coming to our committee. So thank you.
So the question is on the motion of Senator Frentz that Senate File 4256 be recommended to pass and referred to the Committee on Human Services. All in favor say aye. Aye. Opposed?
No.
All good. Motion is adopted. Thank you, Senator Hoffman.
Thank you, Mr. Chair and members.
Senator Hemmingsen-Jaeger. Welcome to the committee. Senator Hemmingsen-Jaeger. Senate File 3868 is in front of us.
Do you prefer to do the A1 first?
Senator Wickland offers the A1 as an author's amendment. All in favor say aye. Aye. Opposed? Amendment is adopted. Senator Hemmingsen-Jaeger.
Thank you. Thank you all for your attention and for being a little bit flexible. I had to run over to state and local gov to do a couple bills and then run back. So thank you for your patience. So this is kind of a continuation of my work that I started in 2023. You'll hear from Detective Lawrence in just a second, but this concern was brought to me actually by the Woodbury PD. They were noticing that there was a high rate of senior citizens getting scammed with this cryptocurrency kiosk, specifically these machines that are found a lot in like gas stations and grocery stores. And when we started digging into it, we noticed that Woodbury had 13 of them at the time, which seems like kind of a lot for a city of our size. And for those of you who may not know, cryptocurrency kiosks they're similar in look to ATMs, but they're kind of the reverse. You take cash out, you put the cash into this cryptocurrency ATM where it converts it into cryptocurrency, and then it's gone. So there's no way to really know that your currency is going to the other side, who it's going to, and if you find that you're the victim of a fraud or a scam, there's really no way to get it back. So we tried in 2024 to bring some regulations into this, but shocking, I guess not shocking. I was a first termer. They're finding ways to circumvent these new laws, and they're still scamming our seniors. And what we found is this is not just happening in Woodbury. This is happening across Minnesota. It's not just happening to our senior citizens. They're attacking and preying upon young professionals, love scams, like it's across demographics as well. So in order to address this, some cities are stepping up. St. Paul, they have a letter in your packets. They passed an ordinance banning these cryptocurrency kiosks in their city. Forest Lake last year also increased their regulations surrounding these little fraud machines, and Stillwater recently banned them. And I will say kudos to Woodbury, they are looking at ways to increase regulations around these as well. To be clear, this bill is looking to prohibit the cryptocurrency kiosks. Also in your packet, you will see a study from the Iowa Attorney General looking at a 94 to 98% fraudulent transaction rate. So members, there's other ways to participate in this cryptocurrency market. These kiosks are the center of fraud, and we need to get these predatory practices out of our state. I have the department here for some technical advice, and I would also like to turn it over to Detective Lawrence for her testimony as well.
Thank you, Senator. And to the testifiers, so after we hear from the department, we have 8 testifiers, I believe 7 in support, and then 1 with some concerns. And I would just encourage the testifiers to keep it terse so that we can make sure we get through this bill today. Mr. Smith, please introduce yourself.
Good afternoon, Chair Klein, members of the committee. For the record, my name is Sam Smith, and I'm the Government Affairs Director for the Department of Commerce. Thank you for the opportunity to provide remarks on Senate File 3868, which proposes a ban on virtual currency kiosks in Minnesota. The department strongly supports Senate File 3868. In the coming days, the department will also present a broader consumer protection proposal that includes this ban as a key component. Virtual currency kiosks have become a growing vector for fraud, with the department, law enforcement, and local municipalities all seeing a sharp increase in scams involving these kiosks across Minnesota. Senator Hemmingsen-Jaeger described the look of these machines. The only thing I would add is that you insert a cash or debit card into the machine, pay a modest service fee, and then purchase cryptocurrency that the company typically inflates by 20 to 30% above market value. Well, it may be that some legitimate crypto investors are willing to overlook these very high fees in order to use cash to immediately have access to the crypto asset. These same factors make crypto kiosks an ideal intermediary to defraud their victims, leaving the victim with no recourse and no money. The department currently has around 400 reported kiosk locations in the state, operated by 7 to 8 main operators. But this number does fluctuate as operators add or remove required locations. I will move ahead in my testimony in a bit for the sake of time, and note that the Federal Bureau of Investigation estimates that Americans, many of them retirees, lost approximately $240 million to crypto kiosk-related scams in the first 6 months of 2025 alone. That's double the pace of similar scams in 2024. While the department has successfully recovered funds for some victims, including $110,000 in 2025, fraudsters rely on crypto kiosks because it is so challenging to recover stolen money. Our data shows that only 48% of consumers receive any refund, and those refunds average just 16% of the original loss. The average loss per reported transaction is over $6,700. Finally, I would encourage this committee to review a letter that Digital Mint submitted to the Wisconsin legislature on crypto kiosks. While I think the entire letter is informative, I would like to share this statement from Digital Mint. What we discovered over the following years was deeply troubling and ultimately shaped our decision to exit the business entirely. Our internal data, encompassing tens of thousands of records and interactions over several years, with our customer support and fraud prevention teams revealed a striking correlation. Nearly all customers who transacted $1,000 or more were victims of fraud. This was not an isolated phenomenon, but a systemic problem inherent to the cryptocurrency model. This is precisely why there is growing interest in banning these products. Beyond the municipalities that Senator Hemmingsen-Jaeger mentioned, I would note that Indiana passed a crypto ban and the governor signed this bill on Monday. And so we are part of a growing movement of states, red and blue, that are alarmed by the trajectory of this industry. Finally, banning cryptocurrency kiosks will protect consumers, law enforcement, and local communities, but will not prohibit transactions around cryptocurrency itself. Consumers will still have access to reputable online exchanges that offer significantly lower fees and safer transactions. Participation in crypto markets will remain possible, but in a way that minimizes risk and protects Minnesotans. Thank you for your time.
Thank you, Mr. Smith. And as you depart, can Ms. Lynn Lawrence or can Mr. Evan Patullo please come up? Detective Lawrence, please introduce yourself and proceed.
Chair, members of the committee, thank you for the opportunity to speak. My name is Lynn Lawrence. I'm a detective with the Woodbury Police Department, and I'm here because cryptocurrency kiosks, the Bitcoin ATMs, continue to be one of the most common and damaging tools scammers are using here in Minnesota. Despite previous law changes, the patterns remain the same. Once the victim puts the cash into the kiosk, the cryptocurrency transfers instantly, anonymously, and irreversibly. By the time law enforcement is called, the money is already gone. Let me share what it looks like in real life. Just 3 weeks ago, officers responded to a gas station after a witness reported a confused woman at the Bitcoin ATM. She had been in an ongoing scam for 8 months and had made 10 to 15 transactions in the previous 6 months. She was already struggling with food and housing insecurity, and she was sending half of her income to the scammers. Another case was a member or a testifier who was not able to be here, and she explained she gets a call from the local sheriff's office. She did not know that spoofing phone numbers was a possibility. She believed that it was her local police department. They put her on house arrest, kept her on the phone pretty much continuously for about a week, and were sending her QR codes. She had to pay fees, fines. It was just continual, just nightmare for her, until finally she had a moment to stop, called a family attorney who recognized it was a scam. And she was even at that point still afraid when she called the police to make the report that she was going to be arrested. And finally, store employees saw someone feeding large amounts of cash into one of the kiosks at a gas station. 2 of our uniformed officers arrived, and the victim actually questioned if they were real or not. And that shows how much control the scammer had. Luckily, officers intervened, and she was able to recover her $16,000. She never did put it in the machine. These are not isolated events. This is weekly, sometimes daily, across Minnesota. Warnings, limits, and refund rules are not stopping the victimization. Scammers walk victims through every step while kiosk operators continue to profit. Victims are not reporting for a variety of reasons, mostly embarrassment. Cities trying to restrict or ban these machines face lawsuits from multi-million-dollar kiosk companies. Local government and law enforcement are left trying to protect the residents while these companies collect revenue from fraudulent transactions. We need stronger statewide action. Generational wealth is leaving our country at alarming rates. Thank you for your commitment to protecting Minnesotans. I'm happy to answer any questions.
Thank you, Detective. Those are alarming stories. And as you clear, can Investigator Derek Anderson please come forward? Officer Patullo, please introduce yourself and proceed.
Good afternoon. My name is Evan Patullo, and I've served as a peace officer with the Elk River Police Department for over 21 years, the last 6 in investigations, so thank you for this opportunity. When most people think of fraud, they imagine suspicious emails, obvious scams, or other things. What we're seeing now is more calculated. These criminals are organized, technologically sophisticated, and psychologically skilled. They often target older Minnesotans, people who worked their entire lives, saved responsibility, and they trust someone that claims to be from a bank, from a technology company, or even law enforcement, and they trust that the claim is legitimate. These scammers create panic with our victims. They tell the victims their bank account has been compromised, their identity has been stolen, or that their computer has been linked to some serious criminal activity. Then they isolate them. They keep them on the phone for hours. They walk them step by step through withdrawing cash from their own banks and then feeding it into a cryptocurrency kiosk. Even with existing state requirements, warning screens, transaction limits, disclosures, scammers simply adapt. They instruct victims to split transactions into smaller amounts. They direct them to use multiple kiosk locations. They'll even tell them exactly what to say if questioned. In some cases, victims are even coached to lie to avoid intervention. Just weeks ago in Elk River, a convenience store employee recognized something was wrong when observing an older adult at a cryptocurrency kiosk. They called 911. An officer responded and luckily stopped the transactions, but not before just minutes earlier, the same victim had been at a different kiosk location and sent $2,000. The funds move rapidly through digital wallets, often across international borders and through non-compliant exchanges. Traditional financial safeguards no longer apply. Recovery becomes extraordinarily difficult and often impossible. The financial loss is devastating. The emotional toll is often worse. Many victims feel embarrassment and shame. They delay reporting because they believe they'll be blamed or possibly even investigated themselves. These are just my experiences with those that have reported it, but I know there are many others too embarrassed to come forward. While current regulations are well-intentioned and represent progress, they have not kept pace with the adaptability of those exploiting these systems. From an investigative standpoint, digital currency kiosks have become a consistent and effective mechanism for fraud. The policy decision is yours. My role is to simply share what we are seeing out in the field, and what we're seeing is real financial and emotional damage that's happening quickly, repeatedly, and often to those least equipped to recognize the threat. Thank you.
Thank you, officer. Can you make room for Sergeant Jake Lanz? Investigator Anderson, please introduce yourself and proceed.
Mr. Chair, members of the committee, my name is Investigator Derek Anderson. I work for the City of Ramsey Police Department. In investigations, I've been a police officer for about 6 years now. I'm not going to take too much of your time. I agree with all what my colleagues are saying here. We're seeing the same things with investigative challenges with cryptocurrency kiosks, mainly due to the global reach of them and the currency. The brokerages in which the money goes will not work with U.S. legal order oftentimes, or state legal order, I should say. So all I'm going to talk about really is, I guess, the stats really quick. We've had 19 cases in the last 5 years or so with crypto ATMs. I know not an alarming amount of numbers, just hearing that number, but when you look at reporting data, roughly 25% of people report theft crimes, right? And for many of the reasons that my colleagues have addressed before. So that number's probably much higher. The alarming thing is, though, is the median dollar average in these cases. For us in Ramsey, it's right around $9,000. I think for most Minnesotans, that's a lot of money to have $9,000 in your bank account, whether you're young or old. So just with that, that's harming Minnesotans in itself, right? Some stuff we're doing in Ramsey is we've done education for our staff, hoping that word of mouth will reach their loved ones. We've gone on to our local television network to talk about cryptocurrency and the warning of the kiosks, and we've also posted those signs near them as well. We're also considering a ordinance within our city. We're waiting for the current legislative session, though, to conclude before we make our decision. So that's what I have. I thank the committee for their time.
Thank you, Investigator. Can you make room for Sister Agnes Foley, please? Sergeant Lanz, please introduce yourself and go ahead.
Thank you, Mr. Chair and committee. My name is Jake Lanz. I'm a sergeant with the St. Cloud Police Department. My assignment is supervising our criminal investigations unit. So part of what we do on a day-to-day basis is handling financial crime investigations, and obviously the crypto ATM cases are one of those. It's not something that is just particular to the metro. It's something that we're experiencing outstate in St. Cloud as well. We have dozens of these crypto ATMs that are being utilized for these scams. And of those, over the last few years, of those few dozen cases, we've documented over a couple $100,000 in loss to our citizens. And in particular, as it's been described, it's typically our vulnerable communities that are living on fixed incomes that just can't absorb a loss like that. In preparation for today, I spoke with several victims just to kind of refresh on their stories. And one in particular stood out to me, and it was touched on earlier, that he was so embarrassed by what had happened, he didn't want any involvement in coming to testify or providing his story today. And what he explained to me is his family wasn't even aware of what he had been through. That's how devastating it is to people's mental health as well. Current safeguards that we have in legislation are being bypassed by scammers. The warnings and things on these kiosks, they're being directed to disregard them and to just continue on with the transactions. So although I agree with the purpose of it, it's that they're finding their ways around it. The retailers that host these eco ATMs are getting a nominal rental fee basically for having it on their facility, but they don't have any responsibility for it or any liability to the losses that people experience. And then just to go into the complexity of these cases, as soon as that cash is deposited, it basically gets fractured into digital currency that is incredibly difficult for us to track. Not only is it difficult, but these transactions occur rapidly within a short period of time after money is deposited. And the other refunds that the crypto ATM companies offer often don't cover the losses, just the transaction fee. So people are getting a refund for the transaction fee potentially, but still losing out on the remainder of the money that they deposited. And then once that money is consolidated, typically somewhere overseas, it's well outside of our jurisdiction to seize and return to the owner. So I appreciate your consideration in Senate File 3868 and your time allowing me to voice my support for it.
Thank you, Sergeant. Can you make room for James Glass, please? Sister Foley, please introduce yourself and proceed.
I'm Sister Agnes Foley. Thank you for asking me to tell my story regarding thieves and Bitcoin. On March 9th, 2005, I opened my Apple computer to the announcement that it had been hacked and said I needed to go to the bank and take my money out. I then received a call, and the person on the phone, who I thought was from the bank, even though he had a foreign accent, indicated he would be with me on my iPhone. After getting my money out of the bank in cash, I was directed to a place on Ford Parkway, a liquor store with a Bitcoin machine. Fortunately, I left the phone in the car. The owners in the liquor store indicated that there had been problems with that Bitcoin machine. So I left and got back in the car, and the directions now were given that I was to go to Target to do this. I decided to stop on the way there at Carondelet Village, which is my home, where I called the person that Sisters of St. Joseph have help with on computers. He had words for the man still on the iPhone. Since that time, I found that my computer had been hacked. I paid $179 to remove both malware and viruses. After that time, my iPhone was hacked, and Consumer Cellular helped. I have since called Apple support, and other things were found on my computer that they deleted. I don't feel safe yet. I turn off my computer each time I am not using it, even if for a short time. My hope is that Minnesota can stop the thieves involved in Bitcoin. Thank you in advance for your attention to this.
Thank you, Sister, for your courage in giving us your testimony. Can you make room, please, for Mr. Larry Lipka? Mr. Glass, please introduce yourself. Go ahead.
Chair Klein, committee members, my name is Jim Glass. I'm a resident of Minneapolis and an AARP member and volunteer. My background is primarily in the banking industry, starting as a bank regulator, then as a risk manager for a national bank here in Minnesota. I quickly took interest in this issue and was literally blown away when I learned about the massive losses happening through crypto kiosk scams. In fact, attorneys general in both Iowa and District of Columbia found that more than 90% of kiosk transactions were tied to fraud. And most scam victims are age 60 plus. That tells us this is not a misuse problem. It's a systemic one, and current safeguards are failing. AARP supported the legislature's efforts in 2024 to add consumer protections, but scammers have worked around our laws and continue defrauding Minnesotans through these kiosks. The 2024 law was an important step forward, but we now know it's not enough to meet the scale and sophistication of this threat. The evidence has become unmistakable. Crypto kiosks remain an easy and effective tool for criminals, and older adults are bearing the brunt of the harm. Minnesota cities have worked to remove kiosks, and just yesterday, the governor of Indiana signed a ban on crypto kiosks into law after the legislature overwhelmingly supported the idea. This growing momentum reflects a shared recognition that stronger action is needed. The Minnesota legislature is right to take a second serious look at what's still happening here and how Minnesota's laws can truly protect older Minnesotans from devastating fraud. Thank you for the opportunity to speak today.
Thank you, Mr. Glass. Mr. Lipka, please introduce yourself and go ahead.
Good afternoon, everybody. My name is Larry Lipka. I'm the general counsel for CoinFlip. We are the largest crypto kiosk operator in the world. We are in every state in the U.S. except for New York that has a BIT license requirement. We are licensed in 40 states with money transmitter licensing, including in the state of Minnesota. Before I started at CoinFlip, I worked at the Illinois Attorney General's office, and I was a public defender, and I was in private practice for about 10 years. I've been with the company for about 6 years, and I've led our consumer protection efforts since I started. You know, I just want to say that we've heard a lot of statistics today, and while I understand that scams are a problem everywhere in this country. They're a problem for crypto kiosks, they're a problem for wire transfers, and they're a problem for gift cards. But nobody is here today saying that we should ban exchanges or gift cards or wire transfers because scammers use them. And all the stories today have been that the scammers are the problem. It is not the kiosk operators that are facilitating these scams. It is the scammers, often in other countries. So I'm here today giving the same advice I gave when I testified a couple years ago in support of the crypto kiosk legislation, which was that we needed to go farther than what the bill actually did. It was a good first step, and it was first of its kind in terms of refunds for scam victims. The kiosk industry right now is the only financial services or money service business industry that has to give a full refund to scam victims. That is contrary to federal Reg E, which requires refunds for authorized transactions, no. Unauthorized transactions, yes. I'm saying that we should do more here, which would include, you know, I've heard people say that the crypto is gone once it's put into the machine. That's not actually true. My company has a consumer protection hold on first users so that they have a cooling off period, so that if they later find out within a few days that they've been scammed, they can call us and they get a full refund because that crypto has not been sent. We have a voluntary fee refund for the fees for any scam victims. So there are a lot of things that we can do in this bill that would protect consumers and also allow people to buy crypto in the way that they want. You know, I've heard that people can buy crypto from other legitimate sources, you know, but they can't use cash. This is the only way to use cash to buy crypto. So for those people who are unbanked or underbanked, or who perhaps don't trust the traditional financial services system, this is their only way to buy crypto and participate in the digital economy. And I'd like to give the example of the currency exchange booths at the airport. This is a very similar model. While none of you on the committee may use cash to buy crypto or use cash to exchange dollars for pesos, people still do at the airport. And that is the same kind of demographic that is using our products. And I do, just so I can get the statistics right. You know, we've talked about the FBI C3 reporting here. So the FBI's most recent internet crime report complaint data shows that online fraud or internet fraud is $16 billion last year. That's a problem. And that's not $16 billion for crypto or $16 billion for crypto kiosks. In fact, about half of that is traditional finance, including things like wire transfers, bank payments, gift cards, and other methods. And the largest alone is the business compromise, email compromise. That was $2.7 billion. And in addition, about half of that is that 16 billion is crypto related, but a tiny fraction of that is at the kiosks. You know, a couple percentage of that is happening. So we're not going to solve the scam problem by banning kiosks. In fact, what happens is you drive people to other forms of payment where there's no way to recover it. There's no company that's going to block that transaction. So the best way to protect consumers is not to ban a product, it is to put in controls.
Thank you, sir. Senator Frantz.
Thank you, Mr. Chair. Thank you, Senator, for bringing this bill forward, and thank you, Mr. Lipka, for your testimony. I wrote down what you said. Nobody is here today but we have a number of members of law enforcement who are here today, and law enforcement keeps us safe and presents credible testimony time and again to this committee. So, Senator, I told you that I had some questions about the bill. You have won me over with your presentation today. I'll be a yes on the bill. I hear you, Mr. Lipka, but once we have local departments signing on to a bill, once those men and women of law enforcement tell us this is the best approach, I think they've earned the committee members' support for the bill. I encourage you to continue those conversations, and if there is a middle ground, if there is a place to find peace in the valley, that'd be fine. But as long as we have members of law enforcement telling us this is enough of a problem to ban the kiosks, it's hard for a committee member who wants Minnesotans to be protected from fraud to say, but I'm still a no on the bill. So I appreciate the testimony. I want to thank the testifiers who came here today, both law enforcement and otherwise. This is exactly the kind of testimony that helps those of us that don't always hear these things. I texted my sheriffs and chiefs just now to say, can you tell me the latest on kiosks in my district? And I just want to say, Senator Hemmingsen-Jaeger, this is the first time you've presented a bill in a committee that I sat on, and I want to applaud you for the thoroughness of your work here. We asked some questions about the frequency and about the harm, and you delivered. And with that, Mr. Chair, I'll be a proud yes vote on the bill.
Other questions from the committee? Senator Rest.
Thank you, Mr. Chairman. Senator Hemmingsen-Jaeger, I have some questions just about the language. I confess the bill was introduced was a complete mystery to me, and I appreciate the A1 amendment, but I just want to make sure that I understand what is happening here. The line 13 and 114 is proposing new law. And by adding to section 1, you get to 3.7.1. But then with the repeal, is simply not all the language that was that's part of 350B 691 is being repealed. It's just under the definitions, the two definitions that would apply to these kiosks. Sub 3B and sub 3C and 11 and 12, and then all of 52B 75. But other than that, the rest of the language that you've included here, just to sort of the context, remains. Is that correct?
Senator Hemmingsen-Jaeger, I can also have council address if you'd prefer.
I'm asking her.
Okay, Senator Hemmingsen-Jaeger. Yeah.
Yes, so the original bill and talking with the department, we wanted to make sure that we were zeroing in just on the kiosks themselves, and we're trying to prevent any unintended consequences, and that is the DE, the A1 that we adopted.
So, Mr. Chairman, it's not any of the rest of those provisions, but only those that will be applied to the key.
Senator Hemmingsen-Jaeger.
If I'm understanding you correctly, yes.
Thank you very much.
Further questions from the committee? Senator Hemmingsen-Jaeger, I will say the representations of the industry were dismaying to me. The basic argument seems to be that scams are a problem everywhere, so why point fingers at our industry? And furthermore, the industry is asking us to fix in your legislation the problems with their own product. And I would put it back on the industry to say, we've heard some pretty horrific stories from law enforcement and from seniors today, and I think your industry owns what has occurred to Minnesotans, and I would ask you to fix your product. But instead, we are going to pass your bill. So the motion is by Senator Seeberger that Senate File 3868 as amended be recommended to pass and be sent to the Senate floor. All those in favor say aye. Aye. Opposed? Motion is adopted. Senator Kunesh. Senator Kunesh, Senate File 1201 is in front of us.
Thank you. Excuse me. Thank you, Mr. Chair and members. Senate File 1201 directs the Legislative Budget Office to collect information from school districts on the details of health insurance plan that they're offering to their employees. We know that 9 out of 10 schools are experiencing staff shortages, and the high cost of affordable living, or affordable health care and insurance is a driver behind the statistics. This year started with 3,200 teachers in Anoka-Hennepin County School District, the largest school district in the state, on the verge of a strike. The big issue wasn't working conditions or salaries, it was the spiraling health insurance costs. One teacher told reporters his premiums had jumped 22% in a single year. He was now paying $1,000 a month just to keep his family covered through medical insurance. But escalating health care costs is not just a big district problem. In Spring Valley, a sixth grade teacher in Kingsland Public Schools, where there are 44 teachers and just 500 students, said it plainly when her carrier announced a major rate hike. Either I get insurance or I get a paycheck. That same story is being played out in Bloomington, Stewartville, Casson-Mentorville, Pine Island, and many more districts. This bill, and this is the important part of it, is that this bill will help the legislature understand the statewide picture around health insurance increases that are putting pressure on our school district budgets. The survey will provide district-level data about employees and potential enrollees, plan offerings and actual values, and plan financials such as district and employee expenditures as it relates to health insurance. In this committee, we are stewards of our public dollars. We heard that just a few minutes ago around security, but this time it relates to education, something that I'm very proud of. We need to be asking ourselves the question around how much of our public money is flowing directly to health insurance companies and insurance brokers. So this bill will help us answer those questions, and I would appreciate your support.
Thank you, Senator. And can we have Amanda Kutke and Lori Goth come forward? Welcome to the committee, Ms. Kutke. Please introduce yourself and proceed.
Good afternoon. My name is Amanda Kutke. I am a science teacher at Klein Silver Lake School District, and I am here asking you to support SF 1201. A year ago, my son came home with what we thought was the stomach flu. After a couple lethargic days of not eating and hardly drinking, my gut was saying that we need to take him in. Sadly, my husband and I often have conversations on what truly is needed when we go into urgent care, as it is a minimum of $250 per visit just to walk in the door. Due to insurance high deductibles and expensive medical care, we decided not to bring my son in due to cost and hoped it was just a virus and it would pass. The next day, it was clear it was serious. After 10 long, scary, touch-and-go days at Children's and several complications from a ruptured appendix, we were asked by Children's to pay our deductible up front, $10,000 right there. We couldn't. Their next suggestion was a $900 payment a month until our bill was paid off. We also couldn't do that. We felt sickened and embarrassed. Our son's life was saved at Children's Hospital, and we couldn't pay them our bill. A GoFundMe was set up that helped a little, and we're forever grateful, but it really shouldn't come to that. Last year, between our premium and our deductible, my husband and I paid $26,000 before insurance started covering any cost. That is just under half of my yearly salary. This one situation financially tanked us. We are two hardworking Minnesotans who can't afford our day-to-day lives now. There is so much wrong with this picture. No one should have to debate if we should bring anyone into a doctor due to a concern of financial burden. but we do. To this day, not bringing in my child sooner haunts me. And I probably could use some professional guidance and therapy to forgive myself, but I can't afford it. My paycheck after taxes, my paycheck after taxes goes to health insurance and our mortgage. After an 18.1 insurance increase last year, and now an additional 14.5 this year, my paycheck no longer covers these two necessities, and we're now digging into my husband's paycheck to get our mortgage covered. And his paycheck still needs to cover all the rest of our monthly expenses. We are going backwards, and the price of health insurance isn't coming down. Our district right now is out for bids for this next year, and we are seeing anywhere from a 30 to 50% premium increase. My husband and I will not be able to support my family if things don't change. And the conversation of me having to leave a career that I love is now in discussion. I love my job and I love my students. I am a public servant with a very challenging, hard job that many people do not understand until they are in our shoes. But I can't stay in the profession if I can't even make my own family basic needs. In 2023, the legislation made a historic investment in public education, one that was supposed to deliver relief to teachers and students across Minnesota. And thank you for that. However, in district after district, most of these gains are swallowed up out of out-of-control health insurance costs before that money even reaches the classroom or a paycheck. To understand the scale of this, in the last 6 years at Glencoe Silver Lake, our health insurance has increased 165% for the same coverage. Right now, hundreds of individual districts are replicating the same work, requesting and analyzing bids of health insurance. This bill does not represent a burden onto districts, as 95% of us are getting the information gathered for bargaining purposes. Again, Glencoe Silver Lake is looking at a 30 to 50% increase. SF 102 will gather vital information on how much districts are spending on healthcare costs across the state to help inform a solution to this problem, such as a statewide health insurance pool for educators. Please, I urge you to support SF 1201.
Thank you so much, Ms. Kotke. Ms. Goth, please introduce yourself.
Thank you. Chair and members, my name is Lori Goth, and I'm a special education para for the St. Michael Albertville School District. I provide academic support in general education classrooms, and I run a resource room where students can get extra help. There was a time when education support professional jobs were sought after because of the good pay and great benefits. But after 25 years of underfunding by the state of Minnesota, our wages and benefits have not kept up, and positions like mine are hard to fill. When bargaining, the district comes to the table, says, this is your budget, wages or health insurance. Not everyone takes the insurance, but everyone takes the wages. So the insurance gets more expensive and the plans get worse. After decades of disinvestment, my insurance is, well, bad. I'd like to tell you about my son. One day he woke up and couldn't see out of his right eye. After many appointments with many doctors and specialists, and patiently, also known as agonizingly, waiting for test results, numerous MRIs, we found out he has a rare eye disease. It took a year, but the doctors found a way to stabilize it. Unfortunately, our insurance will not cover the medication that the doctor prescribed. Instead, we are forced to use a medication that is for children with cancer who are waiting to have a bone marrow transplant. It suppresses the immune system and has possibly devastating and irreversible long-term side effects. He needs to be on this for at least 3 years and possibly forever. This medication isn't covered by insurance either, but it's $168 a month out of pocket rather than $7,000. I work 3 jobs to pay for medical expenses. Excuse me. And my son may still lose his sight. I'm sorry. Imagine telling your child that you can't afford to keep them healthy. I don't want to be just one more sad story, but I do want to put a face to a statewide problem. ESPs in every district in our state are struggling to care for our families. This is a statewide problem, and it needs a statewide solution. This report will help us understand the full scope of the problem and what it would take to provide us with the kind of health insurance that would allow us to care for our kids at school and our families at home. I encourage you to support this bill. Thank you so much for your time.
Thank you to the testifiers. And before we go to member questions or comments, I just want to say that there is a proposal bill that is not in front of the committee right now that would sort of create a larger pool and try to solve this problem for the two testifiers. The bill in front of us simply is sort of gathering data, getting a report from the districts to see, what the actual numbers look like so that we can be wise when we get to that bill. And I will also say, Senator Kunesh, that these heartbreaking stories are not going to be isolated to educators or paras alone. I think as the cuts coming from the federal government roll out over the next year, every person in Minnesota is going to have a story very similar to your two testifiers. Questions or comments from the committee?
Mr. Chairman.
Senator Latz.
Thank you, Senator Kunesh, for bringing this forward, and I look forward to the report and learning more about what the options are. Trying to address these issues has been around the legislature, I think, since as long as I've been in here. In various versions of ways to address this. I know that 2 of the 3 school districts that I represent have approached me in the past or this year, in fact, just a few days ago, suggesting that they are in a stronger position within their own district bargaining process and with their health insurance coverage to be able to provide better coverage than any of the proposals that have been made in the past for consolidating into a statewide pool or a regional pool. So I will be looking not only at the results of this report, but we'll be consulting with my own local districts to find out whether or not they will be advantaged by any proposed outcomes to resolve these issues. It doesn't mean there aren't a lot of districts that would benefit from a consolidated pool, but I think not every district will, and some districts feel that they've already got better plans and would be seen in some sort of a consolidated pool, and of course they look out for their own members' concerns and interests first, so they don't end up in the same kind of position as the ones that we've heard about today. So thank you for this information. Evidence is always really helpful to help us make informed decisions here, so I'm glad you brought this forward.
Senator Dames.
Well, thank you, Mr. Chair, and certainly these are some stories that certainly merit a lot of thought in this process. But at the end of the day, let's not kid ourselves. Last week we sat here and we passed mandate after mandate after mandate. And then we wonder, and I said, I think at that time, that it won't be long and we're going to be back and we're going to be discussing insurance costs are too high. And here we are within just a few days, we're back talking about insurance costs are so high. Why are insurance costs so high? Because we keep doing things that are going to drive the price. Now, I'm not saying we should or should not pass the mandates, but then we have to understand the backside of it. We keep kidding ourselves into thinking that there's going to be some magic bullet out there and it's not there. We think about we should go to having single payer insurance, and that's where this is leading to, is we want to have single payer insurance. Folks, let's be very honest with ourselves. The government is not going to run an insurance plan cheaper than a mutual insurance company. You can create a separate pool. You can feel it's going to do everything you want it to do. The costs are going to be there. How many years have we been trying to turn the public employees insurance program into the pool for the schools? And it hasn't worked. We've even went as far as to indicate that they got to give so many years. For a while, they had it real lopsided as to the PEEP had a better shot at getting the schools, and they didn't. And many of those schools that went on that program went back off the program because it wasn't saving any money. So what's the point here when we're going to just finally say, okay, we need to deal with the facts and not think that we're going to come up with some golden bullet that's not out there? That bullet is not out there. Are cost of health insurance too high? Yes, they are. But then look at what the expectations we have. When we go to the doctor, we expect nothing but the best and the fastest and the finest. And that's okay, but then we have to pay for it. We talk about other things that drive the cost of insurance. Now, the paid family leave did not drive the cost of health insurance up. But what it did is we had the superintendents of the schools in here last week, and many of those folks came to my office and we talked. Many of those schools, the cost to them for paid family leave is going to be in excess of $1 million. Now think about that. Where did that $1 million come from? It come out from the budget that they had. Now, did that drive the health insurance up? No, it did not. But did it take $1 million away that probably could have been used in negotiations to share with the teachers and share with the employees of the district? I would say it did. Look at a lot of the things we've done in the last 5 years. Take a look at the cost of health insurance in the last 5 years. Take a look what some of those drivers, and take a look at the number of expensive mandates that we passed in the last 5 years. I'm not saying we shouldn't have passed them. I am saying let's get realistic and start realizing we can't keep running the cost up and not figure out how to pay for it. When you spend money, you have to have revenue to cover it. And we're at a point to where we have to figure out how we're going to do this and stop kidding ourselves that a single payer plan is going to be the answer, because it's not going to be. And then we're going to have ourselves dug in really deep. So let's be more serious about that, and let's realize when we're going to have the days when we're going to have a mandate day and pass a lot of mandates or send them someplace else to be looked at, don't kid ourselves. Those cost money, and it's going to be at the end of the day, it's going to be in the premium. Thank you.
Senator Duckworth.
Thank you, Mr. Chair. I appreciate it. Just a quick question from the bill author, if that's okay. Senator Kunesh, have you gotten any feedback from like the Minnesota School Boards Association or superintendents in regard to this report, or kind of what it's looking at more generally? And if you have, be curious to hear what that feedback is.
Senator Kunesh.
Thank you, Mr. Chair, and Senator Duckworth. I have had conversations with different groups or individuals, and while they don't have, haven't given me like a formal response, many of them are very interested in finding out what the results of this report are.
If I may, Mr. Chair.
Senator Duckworth.
And I promise to stay on topic. I know sometimes it's tempting to talk more education, but I'll stay on topic. And the reason I asked that question is at the beginning of the bill introduction, Anoka-Hennepin, the school district, was referenced. And I've heard specifically from their superintendent and from their district as to why they faced the deficits that they did. And so to have a more full-ranging, encompassing conversation regarding this issue, and I appreciate you both being here to testify and share your personal examples. We find a lot of folks, whether they're teachers or staff at our schools or in our districts, that have really been hit by a double whammy. Part of it's what Senator Dames just explained, which is if the government's going to pass a lot of laws that increase the cost of health insurance, and then the government's going to pass a lot of unfunded mandates that put districts into deficit, that's a huge double whammy for those folks at the district level, whether they be teachers, staff, bus drivers, you name it. And so sure, a report might help and shed some light on that, but I think the more holistic conversation about what are the large cost drivers or what are the trade-offs between some of the laws that we pass and how it impacts everyday people, their budgets and affordability of health care and just living in general is extremely important. And we're kidding ourselves if we're only ever looking at these things in an individual silo and we're not looking across the breadth of all the impacts of the laws and regulations and statutes that we pass, no matter how well-intended they may be. And I just wanted to add that aspect to this conversation so that it is an all-encompassing one and that we're mindful moving forward regarding the legislation we passed and what those trade-offs are going to be. Thank you.
Senator Frentz.
Thank you, Mr. Chair. First of all, Senator Kunesh, thank you. You have our support on getting the information. I think that's going to be helpful, and I hope members of the Commerce Committee see the value in finding out from the other 1/3 or so of the districts what the story is. I like that. You have my yes vote. To my colleagues, this is why the defrayal bill I thought was properly heard in this committee, is if we want to increase the cost of health care and the state doesn't want to pay for it, I think we better ask ourselves some tougher questions. Mr. Chair, I applaud you for the work you've done on costs in here. I think this is a moment for Minnesota to say, where are we in healthcare? And I just want to toss out, what I see here. We have 4 or 5% of Minnesotans who don't have health care coverage, and they are without question those that have the least. That is absolutely not the direction we should be heading. I'm not suggesting a single-payer plan. I'm just saying it's time for Minnesota and America to ask some tough questions. Do we want to have people who don't have health insurance? Do we want more stories like this? I don't think we do. I do think other countries have answered some of those questions with some very tough decisions. And what I've seen in the last 10 years in the Senate here is we tend to say, we'll add more coverage without adding a funding source that has met the rising costs. And those costs include members of the Commerce Committee, the simple things like labor, equipment, new technology. Those are all incredible advances. We're delivering health care in this country that 50 years ago we could not have dreamt of. That's a good thing. But we better get serious about health care or we're going to have these same kinds of problems. And I had my superintendents in my district as well, Senator Duckworth, and you mentioned paid family and medical leave, and I'll just say, I like the fact that we have to budget and balance the budget. I think that's a good thing. Sometimes we dodge some of the tougher questions, and I think we should stop dodging and get to it. Thank you, Mr. Chair. Thank you, members, and thank you, Senator Kunesh, for the bill.
Mr. Chairman.
Senator Rest.
Thank you, Mr. Chairman. Senator Kunesh, have you consulted the school districts to ask how readily available the information is on the survey that you are requesting? And, you know, I'm concerned about unfunded mandates as well, but I also think that the information here is extremely important in not only to the school districts, but to us and to these parents who are here to understand what could have gone differently for you. And then, have you estimated what that cost would be for school districts? And then in your appropriation, do you have any idea of what you would be asking the LBO for the appropriation? Or have you requested a fiscal note from them on what it would take to conduct the survey?
Senator Kunesh.
Thank you, Mr. Chair. We understand, and Education Minnesota has worked with the districts in the past to gather some of this information. This is information that districts readily keep organized and have quick access to. As far as the LBO, from what I understand, they feel they are well-equipped to run the report and collect the data. We have not, from what I understand, asked for a fiscal note at this point.
Well, Mr. Chairman and Senator Kunesh, you've got an appropriation there for it, so I would hope that you would be asking them what they're going to need. And if this information is already collected by the school districts, it seems to me that, okay, quote, it's an unfunded mandate, but this one could be very easy to accomplish because they already have the information. And it's on that basis that I am supporting your bill, and I appreciate it, but I want to know how much the LBO is going to say it will cost. And it would be nice to have in the next step affirmations from the school districts that, yes, we already have this. It's a matter of compiling it and would not be an expensive or overburden for the school districts to provide it. Thank you very much, Senator Kunesh, and thank you, Mr. Chairman.
Thank you.
Other questions from the committee? Any closing?
No, just that, you know, we can't make decisions without having the information and the data. And from what we hear across the state of Minnesota, the cost of health insurance to our school systems are vastly different. And the one thing that we know for sure is that they are growing. The cost is growing. And when a parent has to decide whether to take their child into the emergency room when they know they are very ill, or when you have to subsidize the medication that you know is going to help your child with something that is less than, That's not right in any way, shape, or form. And we need to get to the bottom of this. We won't be able to get to the bottom of this or have a good picture of where all those dollars, because remember, those are taxpayer dollars that are paying for it. We are paying for it one way or the other. And if we don't get control of that and find out where that waste or where that excess is, we can't make those changes. And so it is our responsibility in so many ways as legislators, as well as our own moral responsibility to get an idea of where this is, what is happening, where it's happening, why it's happening, and then use that basic information to make good decisions. So thank you for hearing this bill, and I ask for your support.
Thank you, Senator Wickland. So the questions on the motion. Senator Kunesh. The question is on the motion of Senator Wickland that Senate File 1201 be recommended to pass and refer to the Committee on State and Local Government. All in favor say aye. Aye. Opposed? No. Motion is adopted. Members, I know that we are on time, and we have 2 more bills on the agenda. I'd like to get through 3794, and then we will move 2484 to the next agenda. Senator Seeberger. Senator Seeberger, Senate File 3794 is in front of the committee.
Thank you, Mr. Chair. I am only too pleased to wear my St. Croix Valley Riders vest again next Thursday when we hear my other bill. But today, right now, we are here for Senate File 3794. At its core, this bill allows banks and credit unions to offer custodial accounts for digital assets, essentially a modern safe deposit box for digital assets such as cryptocurrencies. This legislation ensures that Minnesota-based financial institutions can continue to serve their customers and members as financial services evolve, rather than forcing Minnesotans to turn to unregulated, out-of-state, or even offshore providers for services that are being used today. This bill does not push financial institutions into speculative activity. Instead, it allows banks and credit unions, if they choose, to offer custody and safekeeping services under rigorous financial security and integrity standards overseen by both state and federal regulators. The standards for digital assets mirror those that already apply to other assets held in custody by credit unions and banks. Institutions must maintain written policies addressing risk management, cybersecurity, internal controls, and business continuity, and they must notify the Department of Commerce before offering these services. This framework and protection matters to Minnesotans and helps ensure that innovation happens here under Minnesota's regulatory supervision rather than outside of it. This also helps level the playing field, and it's about consumer choice, protection, and competitiveness. For the communities I represent and for the many Minnesotans who want innovation without sacrificing trust, this bill strikes the right balance, and I respectfully ask for your support.
Thank you, Senator. Mr. Ryan Smith, please introduce yourself and go ahead.
Good afternoon, Mr. Chair and members. Ryan Smith. I'm here on behalf of the Minnesota Credit Union Network, and we're representing the 82 credit unions across the state. I did have a fantastic 30-minute presentation for you all today, but in the interest of time, we'll just go ahead and leave it just by saying that we strongly support the bill. We worked hand in glove with the Department of Commerce, also with our counterparts over at the Minnesota Bankers Association, to craft language that we feel helps local Minnesota financial institutions maintain relevance in the face of a kind of a changing payments ecosphere and changing consumer sentiment. So with that, Mr. Chair, I will leave it and take it from there. Thank you.
You bet. Thank you, Mr. Smith. Mr. Larson, please introduce.
Yes, thank you, Mr. Chair, members of the committee. My name is Chase Larson. I'm the Executive Vice President and Chief Lending Officer for St. Cloud Financial Credit Union. I've also had the privilege to lead our digital asset strategy over the last 4.5 years. Personally, my journey began with digital assets and blockchain in 2016. Our credit union serves 28,000 members in central Minnesota. We're a 97-year-old credit union. And I think what this bill is about is two things. Well, first, what it's not about is crypto hype or digital asset hype. We're in support of this bill because it's focused on consumer protection. Credit unions have custodied or helped members store or safekeep their wealth for 100 years. It used to be stock certificates in safety deposit boxes, gold bars behind a vault, and today that wealth is evolving. And so to me, this feels like just a continuation of our business model. The second piece is what a lot of Minnesotans or consumers don't realize is when they hold digital assets on cryptocurrency exchanges, such as Bitcoin, they don't actually own the underlying asset. They have an IOU from the exchange, allowing local financial institutions to provide custody or digital safety deposit box services will provide consumer protection. The second piece is relevancy and liquidity. Our credit union in central Minnesota started measuring our deposit outflows to digital asset exchanges about 3 years ago. 3 years ago, it was $1 million. In 2024, it was about $5 million. Last year, it was just over $15 million, leaving our local community, going out to places like Coinbase. With regulation, it allows us a path to bring that liquidity back into our local community. Thank you.
Thank you, Mr. Larson. Is there someone from the department that wants to comment on the bill? Mr. Hoff. Welcome to the committee. Please introduce.
Thank you, Mr. Chairman and members. My name is Jason Huff from the Department of Commerce, and I'll testify briefly on Senate File 3794. The department appreciates many Minnesotans value virtual currencies, and we support efforts to incorporate virtual currencies into our regulatory framework where appropriate. Senate File 3794 levels the playing field and allows Minnesotans to safely keep their virtual currencies with a trusted community partner, excuse me, like a credit union or bank.
Tremendous. Thank you for your testimony. Question? Senator Rasmussen.
Thank you, Mr. Chair. And I have a question for the bill author, the testifiers, whoever is most appropriate to handle this. I wanted to ask how many other states allow this, and for federally chartered institutions like federally chartered banks, are they able to do this under law?
Senator Seeberger or either of the testifiers.
Chair, thank you. Yes, so today the OCC and the FDIC have, as well as the Fed has come out recently, banks are allowed to custody digital assets for their customers, as well as buy and sell and a litany of other items. As far as the number of states, I don't know the exact number. This bill, to me, seems like it mirrors Virginia, so I know Virginia has passed. Utah has passed, and I believe there's 2 other states that have passed similar language.
Senator Rasmussen.
Thank you, Mr. Chair. Another follow-up. Could you describe exactly what this service is? I mean, is the credit union, does the bank have a server or a cloud storage where they are have captured and encrypted the IOUs that the customer would have access to? Can you just tell me exactly like what this service would look like?
Mr. Larson.
Chair, thank you. Are you asking what the product at St. Cloud Financial Credit Union is, or what the bill would allow a credit union to do?
Senator Rasmussen.
Thank you, Mr. Chair. What the bill would allow a credit union to do?
Senator, Mr. Larson.
Chair, this would allow a credit union to offer custody services to their clients. There's I would say within the outline of the bill, there's a few different ways that a credit union could go about it, but effectively what it's doing is providing a digital safety deposit box that allows the member to have hybrid self-custody. So the underlying asset never leaves the blockchain. So if I own Bitcoin, right, it never leaves the blockchain. What I'm moving is that data or private key data This allows the credit union to offer services where the member can take custody of that private key data in a secure manner inside of their core, which is the most secure and redundant system that a local FI has.
Senator Rasmussen.
Thank you, Mr. Chair. And what if something bad happens? What if the system's hacked and a outside person is able to access those keys, use that to steal the cryptocurrency? Who's liable in that case?
Mr. Larson.
Yeah, when it's a member self-custody, depending on the credit union, there will be waivers in place. At our credit union specifically, if we're hacked, we have bigger problems than our members' digital assets they're storing, but we would follow our same risk and compliance standards that we follow today. So at St. Cloud Financial, we partnered with Lloyd's of London and actually have bond protection for things such as loss of keys, internal fraud, or external hacking, no different than we do with the rest of our business today.
Senator Rasmussen.
Thank you, Mr. Chair. And as a follow-up, does the bill require that? Does the bill require that the credit unions or the banks would have that type of insurance to protect against that loss?
Mr. Larson.
Mr. Chair, the way I interpret the bill, it requires the financial institution to follow normal customary security measures and just as we do today. I don't know that it specifically outlines insurance requirements.
Senator Rasmussen.
Thank you, Mr. Chair. Another follow-up. The bill talks about the institution being able to act in a fiduciary capacity or a non-fiduciary capacity. Could you talk about what that would look like in regards to being a custodian for cryptocurrency?
Yeah, I think the fiduciary and non-fiduciary would, Mr. Chair, would be the difference between off-balance sheet or on-balance sheet custody of the assets. Again, that has to go through the Minnesota Department of Commerce. Today, it's a hybrid self-custody solution and allowing the credit union to engage and offer those services in our state.
Senator Rasmussen.
Thank you, Mr. Chair, and thank you, Mr. Larson. So you're saying that the crypto assets would sit on the balance sheet for the financial institution in certain circumstances?
That would have to be approved by the Minnesota Department of Commerce, but as it currently sits, no. They're off-balance sheet, 100% off-balance sheet.
Senator Rasmussen.
Thank you, Mr. Chair. But as a follow-up, the Department of Commerce could authorize, though, under this language, that this could be on balance sheet.
Mr. Larson.
There would need to be other regulations passed in our state as well as the NCUA.
Okay.
Senator Rasmussen.
Thank you, Mr. Chair, and thank you. And the reason I have some concerns, and I'm not against cryptocurrency. I think it can be a part of someone's assets in their portfolio, and it has a role and a place. I just think it's really careful when we're mixing different financial institutions, and if we're creating a path where this could become a part of a financial institution's balance sheet, that concerns me. And then additionally, there are services out there today that people can go to. They could go to a financial broker within a credit union or within a bank and have this as an asset. So I just want to make sure that with the bill here, as it continues through the process, we're just thoughtful around introducing risk into the financial institutions, because right now, if you're a credit union, if you're a bank, you have insured deposits. It's very safe for a consumer versus crypto. And it's not saying anything negative about crypto. Crypto is very volatile, right? We look at crypto prices can change very quickly. And so you're taking something that's very volatile and speculative, and you're putting it with something that's very boring and insured. And I just want to make sure that we understand that the lines are clear between that. So I appreciate the conversation today.
Senator Duckworth.
Thanks, Mr. Chair. I acknowledge the time, so I'll be brief. First question for Mr. Larson. Do you have any crypto kiosks?
Mr. Chair, we do not, and I am not in favor of crypto kiosks.
Sounds good. A follow-up, Mr. Chair, if I may. So I'm trying to just understand the practicality of the bill before us. I guess it's my understanding that this isn't something that a credit union or a bank here in Minnesota could engage in. Currently, this law would then allow them to engage in it. This isn't a situation in which we're able to do it, but we're looking for some clarity in regard to state statute. Would that be a fair assumption or a fair characterization of the situation?
Mr. Larson.
Mr. Chair, it's my understanding that the banks or financial institutions that are regulated by the OCC and FDIC are actually allowed to move forward. The credit unions are not under Chapter 52, and so this is providing a level playing field for the credit unions.
If I may, Mr. Chair.
Senator Duck.
Thank you. So it's specific to credit unions. I get that, appreciate that clarification. And in practicality, if I'm a consumer, this is essentially just giving me the ability that if I were to log on to check my bank accounts at a credit union, I could see my checking account, my savings account, and my cryptocurrency account, and see the balance in there, and it's managed and overseen by the credit union. Is that sort of a fair, realistic depiction of how this law would play out?
Mr. Larson.
Mr. Chair, yes. Essentially, it would allow a member to custody their digital assets. The credit union's not able to act on behalf of the member, so it requires the member to move assets in and out. One thing I also I want to clarify, the difference between this route and purchasing through a broker. When you purchase through a broker, you're not holding the underlying bare asset. You're holding a derivative of the asset. And so this product is designed for those individuals that are going out and actually buying the underlying physical asset.
Senator Duckworth.
Thank you, Mr. Chair. I appreciate it. When you look at, we had checking, savings account, let's call it your crypto account for lack of a better term. We know the FDIC insures certain accounts, and I think you hinted at this earlier when you talked about some sort of a bond that your organization pursues. That crypto account, from a consumer standpoint, does the FDIC insure it? Would it insure it? Would the institution have to insure it via another means? And are there any mandatory thresholds for a certain amount of funds or cryptocurrency in that account that would be insured? For example, $250,000 is kind of a standard amount for FDIC insured accounts.
Mr. Larson.
Mr. Chair, the way we have it at our institution is our agreement explicitly states, no different than a physical safety deposit box. The assets that are inside of a physical safety deposit box today that our members hold, we're not insuring the physical bare assets inside of those safety deposit boxes. And so the member disclaimers and waivers on the very first page state that the member is custodying assets that are not insured. It's outside of the NCUA insurance. But our specific credit union did go a step further and got overarching bond coverage in the event of a hack, loss of keys, or internal fraud, no different than we do with our standard operation outside of the NCUA insured funds. So if a member if we were to get breached at the credit union and somebody was to have identity theft, we have bond protection or insurance coverage in place to protect our members. But it would be my understanding that financial institutions engaging in these services are making it apparent and clear to the underlying consumer that these are separate from their insured assets.
Thank you, Mr. Chair, and thank you for that information. I would just encourage, I know there's some language in this bill, Senator Seeberger already about fiduciary capacity and informing the consumer, but I would just suggest, whether it be the department or whoever, if this is going to move forward and become law, that we pay a lot of attention to disclosure in how the consumer is looking at this, and maybe even some uniformity, because I can see this very easily varying from credit union to credit union in terms of how they approach this or what the consumer might expect in terms of the safety and security of their assets. So just food for thought there. Right now, one of the things we have from our banking system in regard to different assets is sort of a uniformly understood coverage or insurance regarding those accounts, right? And applying that same mindset to what we're talking about here today from a consumer standpoint should probably be given some consideration as well. That's all I've got. Thank you.
Senator Seeberger.
Thank you, Mr. Chair. This is a good bill. Please vote yes.
Thanks, members, for staying around for the extra time to talk through that issue. It was very educational. I appreciate it. With that, Senate File 3794 will be laid over. There is no further business before the committee. We are adjourned.
Thank you so much.
Thank you.